Hello, welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cacciolo, and I'm the owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I've partnered with them to bring you an easy and educational workday session for today. Today's session is how to warm up for pickleball. So you'll learn what you need to do to improve your ability to move on the court, move quick, get to those dinks without any aches and pains, and prevent any injuries. So a little bit about me. I'm a doctor of physical therapy, an orthopedic clinical specialist, and a certified dry needling specialist. And I've been in the physical therapy field for over 25 years. What we're going to go over today is based on all that experience, and also my time growing up as a tennis player. I played tennis up into college, and then 2 years I've been playing pickleball. And I love it. It's the fastest growing sport right now in America. And it's really, really fun. So let's get into it here. We're going to learn some key moves to properly warm up for your game and avoid injury. Let me pull up my slides here. So first thing here is, because I am a medical professional, I have to give you this disclaimer here that the stuff that we're going to be going over today is useful. It's going to be helpful, but it's geared towards or aimed towards a broad population. So if you're dealing with something specific, please get a complete physical exam from a medical professional so that you can address your root causes and all the associated factors to your aches and pains. Now, if there's one thing that you take away from my talks, and if you've been to my talks before, you know this video, this is key. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So we want to make sure that stuff that's supposed to be mobile stays mobile, and the stuff that's supposed to be stable stays stable. So particularly going from the ground up, the foot needs to be stable. The ankle needs to be mobile. That needs to be a loose joint. And the knee needs to be stable. It's a very simple joint. All it likes to do is straighten and bend. And the hip is a mobile segment that needs to be super flexible. And if we go up from there, the lower back, that needs to be stable. And in the thoracic spine, a lot of rotation happens through there, so that needs to be mobile. And then going into the shoulder blade is the stability point for the arm. The shoulder joint itself needs to be mobile, and the elbow is going to be stable, and the wrist needs to be mobile. So a lot of the things that we're going to be warming up are going to be geared at those roles for those segments. So you think about the movements that you do in pickleball. We're going to be doing a lot of bending, a lot of rotating, a lot of lunging, a lot of quick movements. So we want to make sure that we're able to perform our best. So a couple of things that we're going to address here is we're going to look at the lower body. We're going to do the upper body. Our goal is to increase your heart rate, to increase blood flow so that we can avoid strains, sprains, and injuries so that you can move better, you can feel better, and you can play better. All right, so let me pull up my 2-shot here, and then we're going to get into it. All right, so this is the active participation point of our session today. The big thing is that a lot of times I go to open play or tournaments and people are just getting in there. They'll take their paddle out of their bag and they start going up to the net. Oh, you got a ball, let's get a ball. And then we kind of just dink, right? So you're just dinking at the net to warm up. But the thing is this, that that's fine. But we want to make sure that when time comes that you're able to move quickly. So first thing is we're going to put the paddle away. All right, so we're going to get rid of that. And what we want to do is get some type of stable surface. It's either a wall, a chair, a fence, or even the net post. I've got my PVC pipe here, and I'm going to be using this. The first movement that we're going to be doing is just a leg swing. Now, before activity, we don't want to do any static stretches. Static stretches are held stretches that you're holding for 30 seconds and trying to reach down and stretching out, getting loose. We don't want to do that before, because research shows that static stretches before activity reduces the ability for that muscle to generate force and tension. So we want to be able to be as strong as possible and not inhibit that muscle. So we want to go with dynamic stretching. And dynamic stretching is basically movements that are done through a large range of motion without moving, without stopping, maybe pausing for a second, but really making the moves big and dynamic. Alrighty, so first thing is we're going to do a leg swing. So the leg swing is taking, again, our stable surface, whatever that will be, and we're just going to keep the leg straight, and we're going to swing that forward. Keep it nice and loose. We can kind of engage some of the core, the lower back, and the abdominal muscles by keeping the upper body as still as possible. And what I'm going to do, I'll show you from the side here, is we're warming up this hip. We're getting a hamstring stretch and maybe a little bit of the hip flexor stretch as it comes back. We want to make that nice and big. You can add a knee bend, a butt kick into that. But again, we want to go for nice and big motions. And the recommended time for each leg that we're going to be doing this is about somewhere between 30 and 90 seconds. Okay, so at least 30 seconds, that's the bare minimum. And anything over 90 seconds is kind of like a loss in the return of our time. So we just want to keep it nice and short, maybe about a minute. Hopefully our whole warm-up period doesn't take more than 5 to 10 minutes. All right, so once we do our forward and backward leg swings to warm up the hip, we're going to add some rotations. And rotation, I'm going to use this other PVC pipe so I can hold on to the stable surface out in front of me, is that we introduce this across the body leg swing. So it's important as we swing this leg across the body that my standing leg is going to be still. I'm going to keep my foot flat on the ground. And as I swing this leg across my body, I'm ending toe up on either side. So I go here to here, toe up, toe up, toe up, toe up. And my hands are holding on to wherever that is, and I keep my shoulders as still as possible. So as I rotate my toe up to toe up, I'm rotating this hip that swings, but I'm also rotating through the standing leg. So yeah, I'm going to do this. And because I'm rotating through the pelvis, because my leg is swinging, I'm going to rotate my thoracic spine as well. I'm going to repeat with the other side. So we're going to swing toe up, toe up, toe up. And you can keep the knee loose here. Just kind of let this swing nice and big, just to get your heart rate up, get the blood flowing, and then getting the joints warmed up. So after we do the leg swings, then we're going to start to do some big movements here. Let me just pull up the previous slide. My list is on there. And then we're going to do some squats. So the squats, you could, again, hold on to something stable, and your range of motion is going to be up to you. You think about, like, how low do you need to bend to get to a ding, right? So if we come to here and you feel comfortable with that, that's fine. All right. If you're comfortable just to here, that's okay as well. We just want to get the knees and hips to bend properly and develop a good position and good technique for this functional movement, right? So again, you could hold on to something stable. And the key thing with this move is that we want to keep your feet flat. We don't want to have the heels come up off the ground. We want to keep the feet flat. And the first move that is going to occur is the hips go back and down. We don't want to do squats with the knees forward. Okay, so that really creates a lot of stress on the knees. We don't want to have a tall trunk or vertical trunk with this. We want to go maybe a little bit horizontal with a little bit of a hip hinge. So I'm hinging at the hip. From the side view here, I'm getting from that vertical position, squatting down, I'm leaning forward. My knees haven't gone that far forward, and I'm just going to come out of there. So again, 30 seconds to 60 seconds, even up to a minute and a half, depending upon what you feel. And then from here, if you feel like your knees need to get loose even more, we can do some butt kicks. So the butt kicks are nice and quick, little knee bends, kind of bringing the heel to your butt, warming up the hamstring as well. And then we could start to do some lunges. So the lunges, again, mimic our movement on the court. So if we think about a clock, we want to say start from the middle. This is where the middle of the hands are. And then we're just going to take a quick little lunge forward to 12, maybe out to 1, maybe out to 2, and then maybe out to 3. So we're just going to kind of do that, repeating on both sides, making our way around the clock, right? And that range of motion and how deep you go really depends on your fitness level. You can kind of open up and come back, you know, that drop step. If you're trying to catch that dink off, we want to go around 6 o'clock, right? Also 7 o'clock, and making sure that we can be quick through this, okay? So by this time, your heart rate should be a little bit higher, and then your blood flowing through there. Now, We can move to the upper body. So upper body, just small circles. Key circles are going to be forward and backwards. I think backwards are better than forwards because they activate the rotator cuff, which holds the ball and socket together. All right, so we can kind of go small first and then make those circles big, 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 and then get as much range of motion overhead as possible so we don't miss those overhead smashes, okay? And then we can move out to the elbow and the wrist. What I like to do is just kind of clasp the fingers together and then just roll the wrists. As you're rolling them around, you can go clockwise, counterclockwise, warming up those wrists and those elbow muscles, because the muscles that control the wrist and the fingers, they're located up into the forearm. So we want to make sure that we're moving through all that upper body and getting all that moving, okay? And then once we're ready, then we can start to do some more dynamic stretches and dynamic movements to really warm up. So I have a limited amount of room here. So, but we can do like a little bit of a side shuffle. So we can start off again with just like a little pogo hop and then kind of go side to side and then pause, side to side. And if you want to make this more dynamic, we get down a little bit lower and then side to side. And then we could do like short little runs forward and backward to kind of mimic how we get forward into transition zone or out of that transition zone after we hit our third shot drop. How do we get to the net? Those are things that you can do. Now, I saved the best for last. Now, a couple of weeks ago, I was playing in the outdoors and it was cold. It was a dark night, windy, and I didn't warm up. So I just had gone to the court right after work, rushed there. I didn't have a lot of time to play, kind of snuck a game or two into my schedule. And I just played without warming up, which is a big mistake. And I paid for it because I trained a calf muscle. Now, it's fine now, but one of the things that I really emphasize with a lot of players is because you may have knee pain or some type of hip pain or foot problems, that really stems from how the ankle and foot interact with the ground. All right, if you don't have a very mobile ankle and it's not flexible, there's going to be a lot more stress on the knee. So one easy little ankle mobility exercise is going to be finding something like a chair, a bench, just put that on there. And then we're going to keep that foot flat again, and then start to bend the knee forward. The farther I bring my knee forward, the more I'm going to mobilize that ankle and the knee. Now, the key thing here is as I go forward, I don't want my thigh or my knee to point in a different direction than my foot. So that's the side view. So if I'm going to show you head on here, I've got my foot here totally straight towards the camera. As I bring this knee forward, I'm going to mobilize that ankle, but I don't want the knee to go this way. Oftentimes people, just will fall into this habit of letting that foot turn out and then having the knee go this way when they bend or squat or lunge. Anytime that we're doing something where we have the foot on the ground and I'm going to bend the knee or the ankle, I want all of that facing in the same direction. So if I'm here and I'm going forward, the key to avoid injury and to improve your ankle mobility and your knee mobility is to make sure that the foot's straight, my knee and thigh and my hip are all in line. So that when I go forward and I start to bend this way, I have everything matching in that same direction. I don't have something like my hip goes out like this and my knee is kind of tracking towards my foot, but my hip is out. So as we're going to go through, we're going to go forward and backward. Oftentimes what I'll do to give this a little bit of support and to increase the intensity is I'm going to put my hands on whatever and then start to bend this way. So I really get full range of motion, calf to hamstring, and then ankle is bending as far forward as I can without having that heel pop up. Another way to do it, you probably have seen this, is again, I'm just going to grab my PVC pipe to act as my stable surface holding on. Let's put this person in here, is to just kind of do a calf stretch. So the calf stretch, you probably have seen something like this where we're here, we got one foot in front and then we're kind of going forward. And again, static stretching where we're holding this position here. We're going to do that after our activity, not before we play. So if we're going to turn this into a dynamic stretch for your calf, we're going to go forward and backward. right? And the key thing that we just talked about over here is that this back foot needs to be in a good position. So that means facing forward, that foot has to be pointing forward, and then my other foot can go anywhere, and I'm going to bring my hips forward to get that stretch. I do not want to have this foot go like that and then start to do this. Okay, so that's why we wind up with a lot of knee issues, because we're facilitating or feeding into this faulty foot knee position where everything starts to bend in two different directions here. The foot's facing out, the knee's going in. We want to be able to kind of facilitate this motion where your foot is pointing in one direction and your knees are going to be pointing in that same direction, not inward. The big thing with that, so that we avoid injury. So we have this position here, just kind of going forward to warm up that ankle. We have the foot on the bench to warm up the ankle that way. And then that is pretty much about it. Then you can pick up your paddle and get to that kitchen and start to do your soft things, and then back up and do some of your drops or whatever, and then work on your serves. So once you've got everything warmed up, your heart rate is up, then your joints are going to be able to move better, and then take those quick steps as you're trying to get to those, those dinks, or drop and then get to the kitchen line. So that's it. That's a quick little dynamic warm up for pickleball. Hopefully that was helpful.